that there are some signs of decreasing incidence, now is not the time to let up. Showing that countries, again, using a comprehensive approach, using all of these individual level measures that all of us play a part in, as well as community level interventions that are in place, follow the recommendations in countries and stay the course. Even in countries that are seeing a decline, it's really important to continue to drive down transmission. What we don't want to see is a situation where we're opening up too quickly, because cases will rebound right away. And many countries have experience with this, where they may have opened up too quickly and cases will resurge. Let's not do that again. And all of us have a role to play in that, and we need to be supported in playing that role. So globally, some encouraging signs, although not universal in all countries. But it shows us that we can control this virus. And I think the other important factor is with the identification of some of these virus variants that some countries have noticed or some countries have identified, and it's wonderful that they have been able to identify them through genomic sequencing and sharing that information. Even in countries that have these variants circulating, the one from the United Kingdom, the one from South Africa, transmission is declining in areas where these virus variants are. This is important, because people are scared when they hear mutations and mutants and variants, and they hear scary phrases of using these variants. Transmission can be controlled with these virus variants, and so that is encouraging. But we have to put in the work. We cannot let our guard down. We cannot let up.
Thank you, Maria. Before I give the floor to Mike, I just want to have a quick follow-up question, because last week we were focusing a lot on variants and you were giving us codes, and then some of our viewers are asking, how do you define these codes? So I think yesterday or today you had a meeting with experts on naming those variants. Yes. So maybe you can give us a quick update on that as well.
So yesterday we had a discussion with several groups. There are 3 groups that have a nomenclature, have a naming system for the viruses and the variants. This is the GISAID group, this is the next strain group, and this is the pangolin group. And we brought them together with our virus evolution working group, members of our virus evolution working group, and ECDC and NIH and US CDC. We had a discussion about what are the nomenclatures that are out, how do they work, and do we need to come up with a new system? The discussions progressed in terms of deciding on how we classify mutations, which are easy because those are individual changes in the sequence as the virus evolves. And then what is a variant of interest, which means it's something we need to pay attention to and do more studies on to understand the impacts on transmission, on severity, and on any potential impact on diagnostics, therapeutics, and vaccines, as well as naming variants of concern. So we made progress on those discussions. We don't have an answer yet. I was really hopeful and naively hopeful that we could come up with a very simple solution. We've had incredible suggestions, and my Twitter thread or inbox or whatever it's called, sorry, I'm not cool with Twitter yet, but that is all full of suggestions around using, hurricanes or using, names of individuals. So we're looking at ways in which we can name these variants of concern so that we can explain them publicly. And we want to completely avoid calling the country X variant or country Y variant. There are very important stigmas associated with that, and that needs to be avoided. We will say the variant that was identified in the United Kingdom, or first identified in the United Kingdom, or first identified in South Africa, but that should be celebrated and encouraged because countries are putting in the surveillance. They have not only epi-surveillance, where they're noticing a change, they have genomic surveillance that they've built over time, and they are willing to share this information with us in real time. And countries should not be punished for that. So please, if you are out there and you are someone who is speaking about this, please do not say UK variant or South African variant or Brazil variant or South Carolina variant, whatever that may be. Let's try as best we can to avoid that, because it really has implications, negative implications, and we can do better. So we will keep you informed. We have another meeting that we're planning for, I think, very early next week to kind of progress that discussion, and we will give a readout as we come to some decisions on that.
Thank you so much, Maria. And sorry, Mike, I jumped off. I didn't give you the floor to tell us your views, your views on this encouraging situation.
Sure. Well, people have described these epicurves like, mountains where you go up one side of the mountain and it takes a long time to come down the other side. So this mountain is strange shaped. We got up here fairly quickly, but it's going to take a little while to get down. And we're going to have to watch our feet as we move. And I would say that when you look at the change here, we were going well over 5 million cases a week. We were heading towards 5.5 million cases a week. It's great. We're down to 3.7 million last week. It's still an awful lot of people. So let's be careful. The rain has eased, but the sun's not out yet, and we just need to be really wary at the moment. And I think this idea of following through, and there will be natural calls. People are tired and they're locked up, locked in, but we need to follow through on all the other things. As I've said before, lockdowns and stay-at-home orders are essentially, we're quarantining everybody because we don't fully understand where the virus is in our communities, or the transmission is very intense. And in a sense, as the UK have used this term, and it's a useful term, that in a sense these are kind of circuit breakers. You're trying to break the circuit of transmission, but they're blunt instruments, and it has a big economic effect, it has a big social effect. So as we get through and the numbers start to ease, we've got to go back to doing our contact tracing. We've got to go back to ensuring that contacts go into quarantine. We've got to do all of these things. We've got to make sure that we ourselves as individuals continue to wear masks, we continue to avoid crowded spaces, we continue to make sure we're in properly ventilated spaces, all of those things, because that's what's worked. And if we look, you were discussing the variants are important. It's really important that we monitor the emergence of variants, but it's also clear that in countries, even with the variants, the application of the standard toolbox of measures has really worked well to suppress transmission. So those measures are still working, and people should have confidence in that. We still are in control of our exposure. The virus is evolving, and evolution of the virus is a normal process. It happens. Our job is to monitor that and pick out from all of that noise those variants that might be of concern, and make sure that we understand their implications, and we're on this. And so many other scientists around the world are on that with us. The point that Maria made about stigma is really important. We shouldn't be punishing those countries who've been looking, and those countries who've been reporting, because we don't know in countries that haven't been looking and reporting whether those variants or other variants are there. And maybe just an interesting anecdote on that. We had the great pandemic of 1918. Which country is associated with that in history, Alex? Spain, right? And we say the Spanish flu. So why did it get called the Spanish flu? Didn't start in Spain. Spain was not the worst affected country. It got called the Spanish flu because in North America and in Europe, because of the First World War, media was suppressed because of intelligence issues regarding the war. So the media couldn't report things that would give an impression that one side was weak, or there were so many soldiers who were sick. So there was very little reporting of this influenza that was spreading across Europe. Spain was neutral in the war, and its media were open, and the King of Spain got influenza. So the Spanish media reported it. And all of a sudden there was this huge explosion of this strange flu that was killing people in Spain, and the King of Spain had it. It became the Spanish flu. It has nothing to do with the science of its origins. And Spain has carried that stigma for 100 years. And it must annoy people in Spain. It must really annoy them that this thing that killed 50 million people on the planet is known as the Spanish flu. That hurts. That hurts people. It hurts their reputations. It hurts their sense of well-being. So it's I can't stress more what we have learned from our colleagues in South Africa, in Brazil, in the UK, in Denmark is vital vitally important information. They should be lauded, they should be praised, they should be held up and thanked for the vital information they're giving us. So I think that's really important. But beyond that, going back to the numbers, I said this before after the summer. Many countries failed to follow through on the measures. We didn't keep it up in terms of our testing, in terms of our tracing, in terms of quarantine, in terms of public behaviour and our individual compliance with all of those measures. If we can get the numbers to move downwards and we can reignite some of the activities that we had, I believe we can move towards a more normal situation, especially if the vaccines, as promised, begin to reduce the number of people reaching hospital and we start to see our health system come under less pressure. And within that, over the next, I think we're going to discuss it maybe later, but right now, for me, in many countries, the biggest concern people have is really around their children and what we do in terms of school.
Thank you so much, Mike. And you both emphasized those countries that are having strong surveillance system. How is WHO doing surveillance of variants, or how we are collaborating with countries to know what's going on around the world, especially in those countries where maybe they don't have enough capacities to do it on their own?
So that's a great question, and it's a question we've been getting a lot lately. How are we improving? How is WHO supporting the world in improving surveillance for these variants? It's a combination of things that we're doing. The first of which is to make sure that we have good epi and molecular testing. You know how you hear us say test and make sure we have strategic testing to know where the virus is. That's where it starts. We need to make sure that countries continue to have a robust system in place to active case finding and cluster investigation, that those tests are used and results get back quickly, first and foremost, for public health action, because what we want to do is break chains of transmission. But in the epidemiologic surveillance and all of these figures that you see with the numbers going up and going down, within that you look for trends and you look to see, is the virus moving around as if we would expect? Is there an increase or a decrease like we would expect with the interventions that are in place? And if there's anything unusual, why is that happening? Is there a breakdown in the interventions that are in place, or compliance, or is there something else happening? And in many countries, there is genomic surveillance, testing of genomic sequencing. And that is not, the capacities around the world vary. Some countries have really good genomic sequencing capacities, and others have quite poor, and some don't have any at all. So what we do to improve genomic sequencing around the world for SARS-CoV-2 viruses is we have a reference system in place where we have labs around the world, our SARS-CoV-2 reference labs, who are able to support other countries. And so what we do is we work with countries to have samples shipped from that country to another for sequencing. But ideally, what we need and what we want is genomic sequencing in countries, in building those capacities in countries. So we are looking to leverage existing systems that are in countries. The primary one is the Global Influenza Surveillance and Response System, or GISRIS, which is 150 labs around the world. 89 of those labs are already doing SARS-CoV-2 sequencing, and we're looking to increase that capacity. So essentially, they have a number of samples that they collect routinely, and some of those can be sequenced for SARS-CoV-2. We're also looking to see how we can leverage in-country systems like academic labs, public health labs, polio systems, HIV systems, TB, even commercial labs, and even vet labs that can do sequencing. And that could be done in country so that sequencing can be improved. Because without sequencing, we don't have the eyes and ears on where these changes in the virus may be. But it needs to go beyond just data collection and just, numbers. We are working with countries, and we have networks in place to look at analyzing that sequence data together with the epi data, together with the clinical data, to do phylogenetic analysis, to really understand transmission and virus evolution. And with our virus evolution working group, many are presenting to us to say, here's what we are detecting. But it's a significant effort around the world There are very good regional networks that are in place. There's an excellent one in Pajo in our region of the Americas that are leveraging different systems and supporting regionally. There's a concerted effort in Africa with our African regional office as well as Africa CDC, where there are 10 countries that are building genomic sequencing capacity on top of the sequencing capacity that's there. EMRO has a similar thing that they're working on, as well as in Asia. So there's a lot of activities that are happening around this. But right now we have interest. We have people who want to say, how can we help? Many groups have reached out to us to say, we have extra capacities. How do we help? We're having conversations with the US, we're having conversations with Public Health England, we're having conversations with labs in India to see how they can help regionally as well. But it needs to be intelligent sequencing, it needs to be the intelligent use of these capacities to help us understand, how the virus is circulating. So there's a lot of work in this area. There's a lot of work to do, but what we want to do is leverage and build on existing systems and then build those capacities where they're needed. So we're really thankful to all of our partners who are helping us do this.
Thank you very much. We're receiving a lot of questions already from viewers, so maybe I'll pass this one to you, Maria. Randy, watching us from Facebook, is asking, you mentioned that we're collecting different data and combining different expertise. Are variants more easily spread by air or on surfaces? Do we have any information about variants transmission?
Yes. So one of the big questions we have around all the viruses that are and the mutations are, we look at 5 different things. One is transmission. Are there any changes in how many people someone can infect? Modes of transmission as well. We look secondly at severity. Is there any changes in disease presentation or the number of hospitalizations or numbers of deaths? And then we look at any potential impact on diagnostics, on therapeutics, and on vaccines, because we want to make sure that the countermeasures work. We have had specific discussions with researchers in the United Kingdom, in South Africa, in Denmark, in Brazil. We had a global seminar last week, and I do hope that some of you who asked about it last week were able to join that seminar, where we specifically spoke about transmission. And we had questions that were asked, are the modes of transmission different? So this is still a respiratory virus. It still spreads from one person, from me to you, and it goes through the air. And there are droplets, there are aerosols, so these are particles of different sizes. And it primarily is spreading the same way. This virus can contaminate surfaces. It's one of the ways in which it can, which is why we make sure we clean our hands and we don't infect ourselves by touching our eyes, nose, and our mouths. But the ways that this virus transmits is the same, and therefore we were looking at the interventions that are in place. We've asked specifically of the countries where these viruses are circulating. They haven't changed their recommendations, and as we said previously, incidence and case numbers are declining, so the measures work. But it's important that we continue to do it all. We can't focus overly on one measure. We have to do our hand hygiene, we have to wear our masks, we have to open the windows or be in a good ventilated room, we have to avoid crowded spaces, we have to distance. We cannot forget physical distancing. It's really, really critical, even in addition to all of these other measures. So do it all. Please continue to focus on the measures that keep you safe and keep your loved ones safe. So that's a really important point. So far, the data is showing us that it transmits the same way. We're continually watching this. If anything changes, we will make sure that we update our guidance and we will give advice. We'll issue advice very, very quickly.
Thank you so much. You both shared the encouraging news, but you also warned us there's still over 3.7 million cases this week or last week. Mike, maybe you can answer to this question. Maria said we need to do it all, and I assume the governments as well need to continue with strong measures in place. Our viewer Jessica Naidu, watching us on Facebook, is asking, what are your thoughts on relaxing restrictions? Maybe you can share your thoughts. When is the right time for countries with high transmission to think of easing the restrictions?
I think that decision can really only be made on a country-by-country basis, because, as we've always said, it really is about how intense the transmission is in your country. So if the fire is burning intensely in your country, then it's not time to stop trying to put the fire out. So I think it's down to to each and every country. And then we need to, as those numbers drop, the real issue is, as the numbers drop, are people sticking to the personal behaviours that would allow us to maybe, because when you talk about restricting the measures, I don't think people mind wearing the masks, and I think people are happy to keep up the issues around physical distance, and that people are concerned when they talk about going back to normal life, going back to work, going back to school, seeing our friends again, having people around for dinner. That's what people mean by normal life. It's not about we want to stop washing our hands. I think at this stage, if you had to wash your hands once a minute and you had to wear, you had to wear your mask in bed, I think people would nearly say yes if that means we can get back to our normal lives. So I think we need to separate what people see as relaxing restrictions. We are not going to be able to relax our personal alertness and our personal measures to protect ourselves and our families. We're going to have to keep up significant measures around hygiene, around mask wearing, about avoiding overly crowded spaces, and I think that's going to be for the foreseeable future. Yes. The question is whether some of the other factors in our society the other things we want to do can be brought back online, brought back on stream. And for me, the most pressing one is the education of our children, and whether or not we can bring schools back online, because our children are missing out. They're missing out socially, they're missing out educationally, they're missing out. And they're paying a heavy price. And a lot of schools in the Northern Hemisphere closed at the Christmas break and have not reopened. And kids have been shot back into online learning. And I think many are struggling in that environment, and those that don't have the resources are struggling even more. So there's a deep inequity in that. So if I was looking at this as a country, I'd be looking at, can I get my transmission down to the minimum level? And I think most of the surveys now show the population are supporting that approach. Nobody wants to take a chance of opening up too early and then bouncing back in. I said it, and we said it many times, the worst situation we could get ourselves into was to yo-yo between extreme lockdowns and absolute openings. And I think we're learning that this is not comfortable, going from like everyone does what they want to nobody can do anything. And I think we're going to have to find a balance. I would focus on advising governments to get the numbers down as low as you can. Ensure you expand your testing, expand your cluster investigation, get your contact tracing working again, get in control of the transmission, know where it is, and then consider then asking communities, which do you prefer to reopen? Our schools or I don't know, sporting events? I mean, and I think most people will choose to get back with schools first, and then we see where we are, and then we can look at other things. But I don't think you can have a discussion right now about going back to normal mobility. And the one thing that we've seen in the data is that once populations mobilize and become mobile, and if you look at the way the disease tracks, mobility data in society tracks very well with the incidence data. When people start to get mobile again, and that means mobile and start to engage with each other again, the numbers tend to go up. If we can get people to mobilize and engage with each other in a more safe way, taking the precautions that they need to take, then maybe that won't happen. But each and every time communities and societies have mobilized, we've seen the numbers go back up. And we need to avoid that this time around, especially, and I think most especially, because we now have vaccines coming online. So before you could say, well, we have to do that. But now we have the opportunity to protect those who are vulnerable and the frontline workers. So I think we can go that extra mile to keep transmission low. Because if we do that, and then we can protect our most vulnerable people, then we reduce the pressure on the hospitals. And then there's a different discussion around opening up. Because the opening and closing of society will not need to be totally informed by the pressure on the health system or totally informed by how many people are going to die. It becomes easier to have that discussion. Because the price you pay for opening up won't be measured in body bags, because that's essentially what it's been. You open up and lots of people get infected, but at the end of that cycle, it's infection, hospitalization, and death. And we've paid a price as a society in not being in control of the disease, in opening up and seeing that endpoint. Now we have vaccines who can protect against that end, the severe cases, the hospitalizations and the deaths. And if we can use vaccine properly and prevent that as an outcome, then we can be a little bit more flexible in how we open our society, because we are not dealing with that horrific consequence at the end. We're not paying that awful price for opening up. So I do think the two things are linked. And again, that comes back to the equity issue, because we need to give that protection to all vulnerable people in the world, to all frontline workers, to give each society the chance to open up with some level of fairness. So if we're going to have opening, which I would love to see, I believe it's going to be impossible to bring that opening until and unless we can deliver the minimum number of doses of vaccine to all countries that mean they don't have to pay the consequence and the price of opening, which they'll have to do because of the economic situation. And I think that's where these things all connect, and everyone's got used to the complexities of this. Everyone's become an amateur epidemiologist. I'm amazed at how much knowledge people have around variants and other things. And I think what people have learned in this is there are trade-offs, real trade-offs. You make one decision about opening or closing, that affects your health system, you know. You make one decision about who gets vaccine, that affects who dies. All of these things are linked, and we need to be smart and understand that we need smart decisions that look down the line and say, what are the consequences of this decision today? And each government, I think, is genuinely trying to do that. They're genuinely trying to chart their way through this very complex set of social, health, economic trade-offs. For me, if I want to see the light, really see the light at the end of the tunnel, that we're going to make this, the signal to me will really be that we can get our act together on sharing vaccines. Because that is the signal that we collectively, as a society, are going to protect the most vulnerable and ensure that the consequences of opening our societies are not going to result in death. And if we can do that, then I think we'll be a better society overall. And everyone can begin to open together, and we can come back online together, not in a way that keeps economies and societies, leaving them even further behind. Because much and all, as we've had a huge economic impact in developed countries, many of these developed countries can take that. They will recover. But some developing countries were already in trouble. They're already far behind, and they're going to fall further behind. And we can't afford to let that happen, because that has consequences. That has consequences in forcing migration. It has consequences in conflict. It has consequences in radicalization. It has consequences in basic human rights. This is not, this is something that does have genuine long-term consequences. So again, I'm sorry for going on about the vaccine equity issue, but I think we are going to be judged by this. And it also is not just an ethical issue. I think it's a practical issue. If we want our societies open, if we want to be on the journey to normalization and normalizing the way we live, then we've got to be fair about how we distribute the means to live normally. And right now, the unequal distribution of vaccines means that not all societies are going to get an equal chance to come back online. And that's simply not fair.
Can I come back to the school issue? Please,
Really,
Maria.
because I think it's really, really critical. I wholeheartedly agree with everything Mike said about vaccine equity, and we're in a real pivotal point right now to see how we turn these words into reality and how we actually carry this out and make sure that everyone who needs a vaccine, that are most at risk, most vulnerable, receives it in all countries. But I want to come back to the school issue, because I think, we have to remind ourselves, we've been in this situation before, where transmission is coming down in many countries. We should not forget how we got out of that. And we should learn from, quite frankly, mistakes and things that we did well, things that we did wrong, and how can we do better this time. Schools, it isn't all or nothing. It isn't all closed or all open. And maybe that's obvious, but it feels very much in a lot of the discussions that it's either you are open or you are closed. You are in your non-lockdown or lockdown, and it's yo-yoing back and forth. But there is a calibration that is happening where countries and decision makers are really prioritizing which sectors need to be opened up first. And schools are incredibly important for the obvious reasons of why schools are important for children and adolescents, for their education, for their mental health, for their safety and security, And in many cases, it's where they receive food. And schools operate in communities. If transmission in a community can be brought down, that means that the virus will not have more of an opportunity to enter into that school. But I think it's about prioritizing which is the most important aspects of societies to open up. Schools, one could argue, are one of the most important things to open, to make sure that that is, and to be done safely. And there are ways in which countries have shown us that schools can be opened safely. With some modification, making sure either there's physical distancing in the class, if the children are older, wearing of masks, making sure the windows are open, they reduce class sizes, they've been very creative. We've seen incredible ingenuity and creativity of getting kids back to school. And in some countries, kids have been out of school for 10, 11 months. So this is having a profound impact on their development, on their mental health. Not to mention the challenges of being home and the families that need to be home with those children. So it's really, really critical that schools can be opened safely. But we can't ignore the fact that schools are in communities. So we have to drive down transmission in those communities so that we can get those schools open. And I just also want to touch upon what Mike was saying about this mountain. We're talking about transmission going down and decreasing in countries. And we have equated this before. I mean, I think you could pull up our videos from last spring where we're talking about word for word almost the same thing. When you come down a mountain, you can go up a mountain fairly quickly if you're in shape. But when you're coming down a mountain, you need to be careful. You need to go slow and steady and in a really controlled way. This is how societies need to think about opening up. It's still too soon in many situations. It's not the time to let up. But coming down and opening up in a slow and a staggered way, using the data that is coming from all of these systems that have been built, using the time to continue to surge your workforce, your supplies, your hospital beds, the capacities for contact tracing and testing, that should still be increased across the world, because that's not only going to benefit SARS-CoV-2 and COVID, it's going to benefit any infectious disease. And those systems, this is about building back better. This is part of that. We need to come down that mountain slowly. It's a good sign, but we can't let up. And so I think this is not a matter of days. It's a matter of weeks to months and looking at, okay, how is it going? And as Mike just pointed out, how is it going? And then reassess. Is this working? Can we open up a little bit more? We've seen many countries prioritize certain sectors and then say, maybe I can't have 100% of workforce go back. Maybe we start with 20%. And then we look at how transmission is happening in the community, but also how are we supporting that workforce? What is the monitoring system within that workforce for testing or for health or for information? How do we make those workplaces more safe? Then we open up a little bit more, and then we assess, and then we open up a little bit more. If we do it too fast, we will rebound. And we need to avoid that, and we need to learn from what happened a few months ago. Because SARS-CoV-2 can be controlled with the tools we have now. Vaccines and vaccination programs that are coming online are an incredibly powerful additional tool, but we just need to stay the course.
Thank you, Maria. And here is a question from Anthony Massini. If vaccines will not be able to slow the spread of the virus, then what will bring the transmission rates down? We can't social distance, wear masks, etc. forever.
Well, that's a great question, because there are a lot of studies that are, the vaccine studies are underway, and the endpoint that they're looking at is the development of disease and severe disease and death. And that's the primary endpoint they're looking at. And we have many safe and effective vaccines that are coming online. Those studies have not really looked at transmission, but they will start to look at what is the impact on transmission. We don't have those results yet. Having said that, we do have the tools that can reduce the spread now. And it will not be forever. We will not be in this situation forever. And I think that's important to say, but we don't have an exact end date. People want to know, when is this going to be over? Do you know? I don't know. We don't have a specific end date, but we know that the more we adhere to these measures now, the closer we are to get to that goal. The more vaccines that are in development that are produced, the more vaccines that are given to the individuals that need them most right now, which are those who are our frontline workers, those who are most risk for developing severe disease in every country around the world, that gets us closer to that goal. So we have to be patient. We have to stay focused on what we need to do. Please continue to wear your mask. Please continue to do physical distancing for the time being. We're going to be in this for a while, but we can do this together. We're learning through some of our social science work and our behavioral insights work that it's good role models that help us get through the mask wearing and the avoiding of the parties and if we can do that together and model each other's behavior and say, well, I'm gonna do this, and it's socially acceptable for me to keep my physical distance or for me to wear that mask. More people adhere to that, and I think we can all be a good role model here. So please continue to wear your mask and please continue to physical distance. And as transmission gets under control, things will be lifted, and we just follow the advice, but stay the course.
Yeah. And we need to reach, I mean, the idea of eradicating a virus, as I said this, I think, before, we've only ever done that once in history, and that was smallpox. And, you know, time will tell whether we can ever hope to achieve that with this virus. But, you know, we deal with infectious threats in our lives every day. We all know if you leave a ham sandwich out in the sun and you come back 2 days later and eat it, you'll probably get food poisoning, right? You know, we've all seen the infections that kids get every winter. We've seen influenza and how we protect older persons in our community with flu shots every winter. We don't go into paralysis over these things because we sense that we can manage them. There are risks that can be managed. We can make the food chain safe. We can vaccinate people against flu every winter. You know, we can avoid some of these risks and we can mitigate those risks. We need to get to a point where our behavior and our countermeasures are good enough that we reach an equilibrium, a kind of a homeostasis. We need to reach a balance with this virus, where this virus is not affecting us, our lives, our lifestyles. It's not taking our loved ones away. The way we do that is protect people with vaccination, develop new therapeutics, make this an ordinary disease. This is an extraordinary disease in how it has spread and how it has taken lives away. We need to make it ordinary. And the way you make your opponent ordinary is you make them look ordinary by doing better at the things we do. I don't think this virus is going away any day soon, but that doesn't concern me. What concerns me is the virus is on top right now. We need to get on top. And if we reach a point where people aren't dying from this virus, if we reach a point where our hospitals aren't overwhelmed with this virus, if we reach a point where vaccines are protecting them most vulnerable, if we reach a point where the vaccines can help push transmission down to very low levels, that's good enough for me, because we can go back and live our normal lives. And this virus will become another virus that we deal with in our biome, in this biologic zone we live in, where there are always threats, and we don't have to see this virus disrupt. The reason why this virus scares us, it disrupts everything. It disrupts our lives, it causes death, it disrupts our families, it rips them apart, it disrupts our society, it disrupts our economy, it disrupts everything. It's a disruptor. We have to stop the virus disrupting. Put it back in its box. Put it back in the context where it should be. A low-level virus that doesn't scare us anymore because we know how to deal with it. We're getting there with vaccines. We're getting there with therapeutics. We're getting there with the measures. And I think we can approach more like what is a normal existence in 2021 if we apply all of the knowledge we've learned, all of the tools we've learned. We can get there. And then we'll see when we get there whether we can finish the journey and eradicate. I'd like personally to eradicate measles. I'd like to eradicate polio. And I'd love to put SARS-CoV-2 right in the crosshairs for the same thing. But it's not so easy. And it's not necessary for us to have a normal existence. We don't have to have zero COVID to have normal life. And I think that's very important for people to remember. We can get to where we need to be, and then we'll see where we are and see if we take that step towards eradication. And maybe, as I said, we can throw a few more other deadly viruses in there and finish them off as well.
Look at the countries that have controlled COVID. You know, look at countries that, you know, at Australia, New Zealand, and I know those are island states, big countries, but countries across Asia, many countries across Africa, even countries in Europe have brought transmission down to single digits. I mean, single digits. These are goals that we can have of fighting against this virus together. And those are really powerful goals for us. And that motivation to get us there. What worries me the most is complacency in saying, well, you know, it's just around, there's nothing we can do, or there's these new viruses, and that is not true. There is so much that we can do, and we have to put up a fight every day. I know people don't like the analogy of fighting and war, but we are in the fight of our lives. The fight is against this virus, not each other. It's not a race against each other of who's going to have the best vaccine. It's about multiple safe and effective vaccines for all of the people who need it. It's about how we take decisions every day to know what our risk is and to lower our risk. And that is power that we have, the power of tools, the power of knowledge, the power of governments enabling us to take these actions. It's all of us working together. And to me, that is such a motivating factor. When I see images of sporting events in Australia or in New Zealand, stadiums full, that is what people are aiming toward, is what people want. So we need to stay the course and fight as much as we can to protect ourselves and to protect our loved ones. Because every case that we prevents the opportunity for the virus to spread to someone else. You've heard us say before, do everything you can to prevent yourself from getting infected, but if you do, the virus ends with you. Do not give this virus an opportunity to spread to someone else, and you have power to do that.
I think the other thing, in this for us all is we're not here as hope mongers, to sort of say it's time that everyone steps up and stay the course, and all these words we use follow through. I can tell you I've woken up some mornings and gone to bed some nights hopeless, really. And I've had that experience over 25, 30 years in the field. There have been times dealing with Ebola or cholera. You're in a refugee camp with cholera, and people are dying all around you. There are many people in this world who have lived with the horror of infectious diseases. Mothers losing children to measles in the refugee camp, cholera ripping through the camps in the Great Lakes, Ebola in West Africa and in Congo. Meningitis outbreaks in the Sahel in sub-Saharan Africa in the 90s were just horrific. Thousands and thousands of people dying daily. We overcame them. We have cholera vaccines now. We have meningitis vaccines now. We're taking control of that. But there have been times in the field in Ebola outbreaks where I thought we're losing this. We're going, even in the last outbreak in Congo, we had moments where we thought this is just going to get out of this. We're going to lose this. This is going to be in 5 countries in the next 5 weeks, and the danger in that sort of feeling is you become paralyzed by that hopelessness. You become a sense of a fatalistic sense comes in. There's nothing we can do. And I've had that, so we're all human beings, we feel that, and then we feel the frustration that comes with that. And generally speaking, and again, when we're working in the field together, it often leads then to conflict, and it leads to people fighting over whose fault is this, and eventually you reach that low point where you realize we've just got to get back up. Mandela once said, "Don't judge me by the number of times I fall down. Judge me by the number of times I get back up again." And it's time for us to get back up again and get after this virus. Mm-hmm. We have the tools. We have the new tools like vaccines. We're better. As a society, everyone knows more. Scientists know more. We can do better this time round. We can come out of this. There'll still be problems. There'll be bumps along the way. But I do think we now have some hope that we can get there. And I think that's real. But we have to be real but realistic at the same time. So I don't want us to come across as, well, you're sitting there in Geneva and you can say this, but we're suffering out here in the field. I've had that hopelessness, and I've watched that death, and I've seen the frustration of having perfectly effective interventions that you can't get to people because of logistics or because of war or because of a shut down border or because of your logistics didn't work. And you carry that with you, and those people in developing countries have lived with this for decades. They've lived with this for decades. Unfortunately, the world is experiencing that level of uncertainty now. The world is experiencing that fragility and that sense of panic that comes with a virus that's in control of our lives. This is the experience of millions of people around the world every single day that we try to serve with our partners. And I think but we all feel that sometimes. So we've got to pick ourselves up and go on. And the fact that the numbers have fallen over the last 3 weeks is a chink of light. The fact that the vaccines are coming on stream is a chink of light. The fact that we're getting a better understanding of the variants and their implications is a chink of light, but it's also a concern that we have to manage. all of those things. So I'm not without hope, but I don't want to create a false sense of hope. It's going to take determination. And this is a jungle we're going to have to walk out of. No one's coming to pick us up, and we got to walk out of this together.
Thank you both, because you answered several questions that people were asking. When are we going back to normal? When are we going to eradicate this virus? So you actually answered numerous questions. As we are running out of time, and
Just to interrupt you, when are we going back to normal? I don't want to go back to normal. I don't want to go back to an inequitable world. I don't want to go back to a world where we're exploiting nature and driving infectious disease. I don't want that normal anymore. I want something else. I want something better. I want us to grow and learn as a society. So when we talk about going back to normal, that's not a normal. That normal wasn't fair. That normal wasn't equitable. That normal wasn't minding and caring for the planet we live on, or our environment, or the animals we live with. So I hope when we talk about going back to normal, maybe we need to go on a journey to something better and wholer and more. Well, yeah, and we can say that, and these become slogans. But I think especially young people out there just need to imagine. It's not we hope it'll be better. It can be better. We can make it better. We've walked to the edge of a cliff. We've seen what that looks like, that chasm looks like. We've seen what the world looks like when we're afraid for our lives, we're afraid for our families. We've seen what the world looks like when the forests are burning and we're wondering whether, our houses are going to be flooded or whatever. We've seen that. We've walked to the edge of that. And the question is, as a society, have we learnt enough to change direction and go in another direction that's more positive, more about sharing? We've shared a lot of risks over the last year, but we've also shared new knowledge and innovation, and the public and private sector have come together, and NGOs and others. We've done better in many ways. I'm just afraid we'll get the amnesia that comes with recovery. When you've had a very bad injury, people don't remember the injury of fracturing their leg or the pain and suffering. We tend to, as human beings, minimize or dampen down. We want to put bad experiences behind us, and that's natural, and we tend to forget the pain. And I really hope, before we forget this pain, which I hope we do, that we are also going in a different direction as a society.
And that's why it starts now. I mean, this whole idea of building a better society and what we want our future to look like doesn't start when the pandemic is over. It's starting now. I mean, even in our individual lives, we see with having to be quarantined, the ability to spend time with our families, for those of us who are lucky to be able to spend time with our families, because many are separated from their families and have been for a very long time. But that time that has been given back is something that's different. We see value in that. When we think about the public health workforce that you hear us talking about epidemiologists and contact tracers and lab technicians and clinicians and medical professionals, that is something, that a workforce that is being built now and needs to be reinforced now to help the pandemic now and into the future. This trauma that Mike is speaking about, there are many countries that have had a past trauma with another infectious disease, and they used that experience to build a system that helped in this pandemic.
Absolutely.
Those that had Ebola and measles and yellow fever and MERS and SARS and avian influenza, they built community workforce. They built strategic plans and trainings around what do we do if we see a case? What do we do if we see a cluster? And that has benefited them tremendously in lives saved, in economies saved. And that needs to be happening in every country now. When you ask me about the variants and the surveillance, that's part of it. Having a surveillance system in country and lab and sequencing is not going to be good for the variants. Mm-hmm. Of course it will be good for the variants, but it will be good for infectious diseases and building sequencing capacities in country. That starts now. That started a year ago. That started with MERS. That started with flu. That started with Ebola. That is preparedness. I know there's this fancy phrase now about we need to be better prepared. That is a continuing thing. That doesn't start when the pandemic ends. That has to start now, and that is investments now. So this is incredibly hard work that everybody is working towards, but there's a reason for it. And hopefully we won't have another trauma like this. But we too soon will forget. People have already forgotten last spring, quite frankly, in terms of what everybody went through there. We need to follow through. You keep hearing us say, follow through, stay the course. These words are catchy phrases, but they have meaning because we have to stay focused and determined on what it is we can do to end this, to get through it together. But if we let up, if we become complacent, if we just wait for the next one, we'll have something even worse the next time because we're exhausted and we're frustrated and we want this to be over. So mentally, we won't be able to kind of have that stamina. And that is really hard. So we are hopeful, and I will keep remaining hopeful, but we are realistic, and we know that it's incredibly hard. And we need more stories to be told, about how people are getting through this and what are you doing at home to get through this, for your not only your well-being, but your mental health, and that of your family. So, we say that we're with you, and we really mean that because we're all going through this with you as well. But we do need to remain hopeful, but we have to put in the work.
Thank you, Maria. And you mentioned mental health and well-being, and I think this will be the last question I will ask, and it's interesting coming from our Twitter viewer as Valentine's Day is coming soon. So he or she, I'm sorry, with Valentine's Day coming up, how do we protect ourselves from catching COVID when being intimate with our partner? Should we wait until we get vaccinated?
Oh boy, that is quite a question. I received an email the other day saying, "Oh, get prepared for Valentine's Day." I can't for the life of me believe it's actually, we're in February, right? It is February. I can't believe it's February 2021. It just seems like, as one of our colleagues, Sophia, says, one long day. I think it's one long night, actually, Sophia. But again, how we interact with others, it really depends on sort of where we live and how the virus is spreading. There are ways that we can be close with our loved ones, depending on where you live. Just be safe. If you are feeling unwell, if your partner is feeling unwell, the virus passes between people who are in close contact with one another. So you can protect yourself and be careful, by trying to make sure, first of all, you avoid getting infected in the first place, but follow the advice. If you are infected, stay away from others. You should be in isolation. If you are feeling unwell, stay away from others in case you are infected, and make sure you contact your health provider. But I think people are becoming very creative in the ways that they can, interact with their loved ones. I will leave it there.
But the other thing is, Valentine's Day it's not about partying. It's about celebrating relationships, right? And those relationships are usually between two people. And in that sense, most people who are in those types of relationships may already be in each other's bubbles anyway, right? Because of their partners, their husband, their wife, their partners, their boyfriend and girlfriend. I think a lot of people have ended up in other families' bubbles because of those relationships. So, but the thing, does Valentine's Day require everyone to go partying, to go nightclubbing? Is that Valentine's Day? So maybe we just need to celebrate Valentine's Day in the way it's meant to be, which is individuals celebrating their love and affection for each other. It can be done in many different ways. But I think you'll find that a lot of people who are in those relationships are probably in each other's bubbles, and then beyond that, it really is a matter of respecting the rules in the country. And then if that kind of mixing is allowed, then it's focused on your symptoms, focused on the fact that you will not knowingly put anyone else at risk. Having said that, I don't know about the masks and everything else.
Well, there actually is quite a lot of advice out there about being intimate with others in the time of COVID. So I will refer you to those websites to get specific information. But the virus passes between people, and there are ways in which you can keep yourself safe. So there's nothing different about that. So, but as Mike said, most people are already in those bubbles already.
And I would just add, for those who are maybe emotionally vulnerable at the moment or feeling lonely, to reach out to friends and any close people around and show your attention and support.
Yes, and look in on each other. So contact your friends, give a call, and use the technologies that we have to connect. We say physical distancing. We don't say social distancing anymore, and there's a reason for that. because we need people to be physically distanced but socially connected. And if you live in an area, find out how your neighbors are doing. You can stay physically distanced, but you can check on people. This pandemic does not prohibit us from being kind to one another, and I would argue that is one thing we really need right now. We are seeing a lot of goodness out there, but we are also seeing a lot of ugly. So anything that you can do to be kind to others makes a big difference, whether you're 2 years old or you're 100 years old. In everywhere in between, do what you can to reach out to someone. Check in on your friends, check in on your loved ones regularly.
Thank you.
Yeah, I think it's important too not to be entirely obsessed with COVID. I mean, certainly in our work, it's like 24 hours a day, and you need to find time to be away from that. And I think it's important that people limit their exposure to all this coverage on COVID itself. You can get your information from trusted sources. You can do that once or twice a day. You don't have to be sitting in front of the TV or constantly, because I think it becomes very difficult to deal with that. I know myself. Once a week I have a Zoom call with two friends since we're that height, and nothing to do with medicine, nothing to do with infectious diseases. I spend an hour and a half just laughing my head off and just having fun and just being away from that whole discussion. And I find that hugely therapeutic, because they don't expect me to talk about that. They're not expecting me to give them the 1, 2, 3s of COVID, and they're not looking at me as Dr. Mike Ryan, the executive director of whatever it is, right? They're looking at me as the guy they grew up with. Self-incident, Stanley, if you're out there, thank you. But I do think we need to find those moments, because therapy isn't always in the sense of something you're treated with. Yeah. We all know that ourselves. We know ourselves. Therapy is contact and communication and finding those moments to be with friends, to be with family, even if it's virtually. Yeah. And I think that's really important. And I think we have to recognise the impact that this has had on people's mental health. From kids not being at school and having that social interaction, the isolation of older people in our society. Many people have had very limited contact. So I think we need to recognise that, and as you said, be kinder and give ourselves a break at times, just to get away from this constant focus. We need that as well, and we need to. Even in WHO, we're trying to do that, and many of our staff operate on front lines in conflict-affected situations, and many of them over years don't get home very often and don't see their families, and they're constantly under that stress. And it's a constant concern for me, not just managing the physical health of our staff, but the mental health of our staff as well. So it's a real thing, and it's okay not to be all right about this. We're all annoyed. I mean, virus has come along and just broken everything. It's not fair, and it's done too much damage. But I think we just need to recognize that that's happening, and reach out to people. If you're strong today, you can help someone that's not feeling it, and equally be prepared to accept help. I think that's another issue as well, and this especially to my male colleagues out there. Expressing uncertainty, expressing anxiety is not a weakness, that's a strength. Because I think in general, in society, women are much better at surfacing those emotions and seeking help and assistance and friendship. Men aren't so good at that, and it's something in all our societies, especially mine. In Ireland, people are only coming to terms with mental health as an issue, and then we have the pandemic on top of it, and our ability to talk about mental health and talk about that hugely important issue in our society, especially as society becomes more complex, as society becomes more stressful, and day-to-day life becomes more stressful. So I think the mental health issue is a COVID issue, but it's a much bigger issue in our society, and something we have to really begin to take more seriously, and especially being able to talk about it and then do something about it.
Maybe you can do an upcoming live on mental health, because we've given our viewers assignments before, but we should do something nice for yourself and do something nice for someone else, and tell us how you are getting through. I mean, I think that's also kind of helpful to think of different ways that work for you in the different situations all over the world. We have staff that are in countries, 150 countries and 6 regional offices and headquarters, and working in really difficult situations, but do something every day that makes you happy. Whether it's reading a book or listening to music or just being outside and feeling the sun on your face, play with your family, call somebody, something that makes you happy every day, and turn off that noise. For myself, I get to play with my kids, and we're in the Matchbox car phase with my little one on the floor in our pajamas on weekends. Or I have to say, and this is a personal thing, I watch old episodes of Grey's Anatomy, and that is an hour. I hear some chuckles in the room. I love that show, but it gives me 45 minutes of a complete escape. That's really late at night if I can't turn it off. And everybody needs some kind of escape, whether it's a sports match or whether you're playing with your family or it's a favorite show. It doesn't matter, and don't let anyone tease you. But find something that gives you a bit of an escape. I struggle with this. I really do. I know you do too, turning it off. But we do have to find ways that give us a little bit of a break.
Thank you.
Just look out for other people. Yeah. We all see the warning signs in others, and if you see that, act. Too many of us live with the regrets of not having done something. So, look out for your friends, look out for your family. If someone is struggling mentally, you need to take some action. And there are lots of helplines that will help you take action to help someone else. It's not just about the person suffering, it's about what we do around someone who is struggling. So it's really important that we're watching out and looking out for each other. And when we see something that concerns us or worries us about someone's mental health, someone's particularly in the way people are thinking about life and having ideations that are dangerous or worrisome, we do need to take action. And you can get lots of help. Yes. That helps you help the other person, and I think that's really, really, really important, that we're not just watching our own mental health, but we're looking out for the others around us, for those warning signs that someone's mental health may be deteriorating, and it's not always in the ones you think, it's not always obvious,
Thank you both, and I also want to thank our viewers who are really watching us all over the world. I will just name a few: the U.S., Italy, Guinea-Bissau, Rwanda, Canada, Syria, Nepal, Zimbabwe, Qatar, Malaysia, Denmark, India, Bangladesh, UK, Argentina, Singapore, Pakistan, Japan, Brunei, Poland, Australia, Costa Rica, and many others. But it's really, even though it's late for some parts of the world or super early for the others, we thank you so much for being with us, for asking your questions, and please follow the advice. Stay safe during Valentine's, be creative, and take care of yourself and your loved ones. Until next week, goodbye.